The main objective of the project is to reduce the food insecurity in the community. We target 16 districts through providing food vouchers for these households, either IDPs or in the host community. The main activity of the project is to provide them with a food basket, and the other activities are complementarity or in complementary with these with the food basket, which are cooking demonstration. EALLAF project trained mothers with MANR children, where they trained on how to cook well balanced and healthy meals, plus to training healthcare workers in the health units near to these households, so that these households receive assistance treatment for their malnourished children and pregnant and lactating women also training of the healthcare workers on how to treat these children referred to them by the CHVs.
When we are talking about the MANR project, so we are talking about the multi-sectoral project, and this project also spread in the whole country from the south to the north, and we're working in MANR project in 8 governorates. And MANR project is consisted of 5 main sectors, and these sectors are from the agricultural and food security, economic recovery and marketing systems, wash, nutrition and health. And every sector is divided into subsectors as well. So we have for the agriculture and food security sector, we have the irrigation, and we have the beekeeping, and the beneficiaries for these subsectors for the irrigation and beekeeping are poor beneficiaries, but they have experience in their major businesses in irrigation as farmers and also as beekeepers. And also we have the economic recovery and marketing system. We have the livelihood restoration. So we're targeting those who lost their livelihoods. They were business owners, but they lost it because of the conflict, direct or indirect. And we are now trying to restore their livelihood so that they get more income and they can feed their households. And also for the WASH, we have subsectors including the rehabilitation of water sources. So this is the rehabilitation of water sources in the communities, which is the biggest subsector in MANR project. So we are rehabilitating the water sources in order to provide clean water to the community, so that they improve the health situation. And also we have the sanitation, which is the improvement or the rehabilitation of sanitation system in the health facilities we are targeting under the health and nutrition sectors. And also we have the hygiene promotion, which is the provision of educational messages to beneficiaries at the community level. And also we have the distribution of non-food items, which is the distribution of hygiene kits. And then we have the last subsector, which is the environmental health. And this is the rehabilitation of sanitation systems at the community level, not at the health facility level. And then we have the nutrition, and the nutrition is consisted of 2 subsectors. The first one is the IYCF, and the second one is the management of acute malnutrition. And nutrition is also the services provided as part of the nutrition sector are conducted at the community level and at the health facility level as well. And finally, we have health. So in health, we have 5 subsectors, and this is including the communicable diseases, the reproductive health services, and pharmaceuticals as well. So the goal of MANR project is to provide life-saving activities, and this is life-saving activities through the provision of health, nutrition, and wash activities, and also to improve the food security of the beneficiaries, and by doing the agriculture and livelihood restoration activities.
نستفيد من منظمة أدرا في نشاط الغذاء والنشاط النظافة والماء.
والشعب يعني المجتمع متقبل هذه المنظمة بسبب انه وفرت كثير في المنطقة، في جانب الغذاء، في جانب النظافة، وفي جانب المشاريع المياه والصحة والتوعية.
استفدنا من النظافة، من الصوابين، من الحمامات، الديتول، هذا ادوات تنظيفية وادوات معقمة، حتى لو كان في حشرات او امراض يعني تقضي على هذه المواد كان لم يحصل عليه، لكن استفدنا من منظمة أدرا في هذا الجانب.
So before MANR and EALLAF, we have previous projects since 2014 when we have the complementarity concept started between the two projects funded by the USAID. So, but in 2016 and 17, we had two projects called SALA, funded by ADRA, and FADL, funded by FFP. So there was a complementarity between these two projects as well. So, but we had some challenges that we tried to address in MANR and EALLAF. So we included this from the design of the project. That there will be like a proportion of complementarity between both projects.
The complementarity between both programs is an important one. We have already started with the joint assessment, where both staff went together to the areas to select the communities and beneficiaries together.
Okay, so this assessment was based on the IFRR approach, and this approach is centered towards the nutrition activities, and these nutrition activities are happened at the health facilities that are supported by MANR project. So in this nutrition activities, so we have the catchment areas that are of the health facilities that we are supporting. So the joint assessment was in these areas. So this is like the IFRR approach, which means that these communities under the catchment areas should be benefiting from many interventions, and these interventions is the integration between MANR project activities and also with the complementarity of EALLAF project.
أنا أحلام قاسم، بنتي سلمى سعيد عباس، عمرها 2 و8 شهور، وضع عمرها 1 وشهرين أو 3 شهور. وديتها عالجة، قالوا لي عندها سوء التغذية، حولوني للمستشفى بن خلدون، بس ما هو بعيد، مش قدرت على مواصلات وذا، رجعت وحدة صحيحة بغيره.
وذن المتطوعات يقول أنا ينزلون من أول شهر مع المكتشفات، وهم قدم حالوني للوحدة الصحية، يوزنوها أول، بعدين دوك شعير لا عندها حاد يندوك من هذاك الحمار يعني سام، ولا هو مام يندوك من الوصفات، ونحن مشينا معاهم هذا السام، وهي لما تحسنت بعد رجعونا للمام.
بس تعب علينا دحين مع السنان وماشي، والراشن ما شاء الله كان يكفينا الحمد لله، بس دحين ما يغيبوا علينا شهرين وده تتعب علينا، ما ماشي دخل يومي وده، لا الحمد لله.
قدمت لنا يعني الراشن سلة غذائية، والحمد لله استفدنا منها كثير.
بعد ما استفدنا من منظمة أدرا، المبلغ اللي كنا يعني نجيب برا الراشن وهذا، جبت لي بطارية لأنه ماشي معي ضوء، جبت لي ما شاء الله غنمة، يعني دخلت فيه بحاجات في البيت.
There was a close coordination with the AFTER program with our colleagues, and we shared the same lists of the ERM and beekeeping, and we could also provide them with the food basket. And in the same time also FFP program or households were provided also with a small business, which means that the same beneficiaries of EALLAF, they received food basket and at the same time received small business or beekeeping.
Yeah, so and also we only not just focus at the individual or the household level, we also focus at the community level, so that we have some communities receiving food voucher, but at the same time they are receiving, they have access to clean water and access to health and nutrition services. So that's the meaning of having like more or improvement in the health situation at the community.